Good afternoon, Dr. Henry. Early in the pandemic, when discussing community immunity or herd immunity, we often heard the number 60% to 70% might be enough. Lately, I'm seeing estimates that it could be considerably higher. I see Dr. Fauci in the U.S. saying, well, it could be 85 to 90%. Do you have you had occasion to revisit those estimates, and what would be the implication if it is higher, please?
Yeah, so we have been thinking about this and talking with our modeling teams and others. So really what we're looking at for community immunity, herd immunity, is the reproductive number. That gives us a sense of how infectious a virus is, or a bacteria even, but particularly with viruses. So if we think about the ones that we have immunization programs for, and this is important because the concept of herd immunity or our community immunity really is about how many people need to be immunized. It's not about people getting infected with that virus or that bacteria, because that confers immunity in a different way, but it also has the inherent risk of hospitalization and death, which we're trying to avoid. So the concept of herd immunity is based on our reproductive number, and if we look at measles, which is the most infectious virus that we have an immunization program for, and measles has an R naught of about 13 or higher. So we think about influenza, it's down around 1.5 or so. For this virus, we're seeing it somewhere around 2-ish, the R naught, so in the naive population. So that if we look at an R naught around 2-ish, then we're thinking if we have enough, 60 to 70% of the population is immunized, that should prevent those transmissions to most people. It still will not prevent some of those super spreader events if they're in the right situation where you happen to have an ill person and a bunch of people who are not protected in an indoor situation with crowds, etc., and poor ventilation. But that could be, that could be enough to stop that widespread community transmission. Where I think Dr. Fauci and others are concerned about is the increased transmissibility we're seeing with some of the things like the UK variant. And as the R naught goes up, and they're saying maybe by 0.4 or 0.7, so from 2 to 2.7 or 3 somewhere around 3, then you need to have more people protected before you can prevent those transmissions. So before the virus it runs into dead ends wherever you go. So yes, people are concerned that with particularly variants that we're seeing arise, that we may need to immunize more people. We're continuing to look at it as we go. I think that probably 70% is something to aim for. But of course, we want everybody to be protected as soon as we possibly can.
Vaughn, do you have a follow-up?
Yes. In discussing the issue of healthcare workers and workers in long-term care refusing or choosing not to be vaccinated, we've heard that, well, it might not be a problem because most would be vaccinated, and so if herd immunity or community immunity is low as 60%, then that wouldn't be an issue. But I'm wondering if it is higher, would thought have to be given to reassigning people in long-term care or health care who choose not to be vaccinated?
Yeah, probably not reassigning. I mean, this is something that we've considered for many, many years, and around influenza immunization every year, where it is so important for us as healthcare workers because we know that the influenza vaccine doesn't work as well, particularly in older people and people with compromised immune systems. So really, they are dependent on us not bringing influenza into a long-term care home, for example. And we know that with concerted efforts, we can get immunization rates up to 80%, and that has a protective effect, particularly in long-term care homes. The corollary, of course, is this vaccine provides protection to elderly people as well. And from what the trials show, that's very good protection. So that helps us as well. But the other thing that is incredibly important, we do not yet know from this vaccine whether it's going to prevent infection and that low level of transmission that can happen. So right now, we all need to continue to take those measures like wearing personal protective equipment, keeping our distances from each other in enclosed spaces, all of those things that we're trying to do now, monitoring ourselves for symptoms every day, getting tested regularly. Those types of things will need to continue for the foreseeable future. We will have more data by next week about coverage rates in the care homes that we're immunizing last week and this week, and we'll have a better sense of that. But I'm also hearing from many care aides, nurses, physicians across the province and from my immunizer colleagues that the uptake is very high in BC. And I think that has a lot to do with being open about the vaccine, about what we know, what we don't know, providing people with people absolutely have questions, and that's what we are there to answer so that they feel confident receiving the vaccine and knowing that it's safe and that it works.